Welcome to the Deep Dive. Today, we're unpacking a challenge that, well, many of you or maybe your loved ones might be dealing with right now. It's the incredible complexity of managing medications, especially when something new comes up, like, say, a cancer diagnosis. Suddenly, you're not just handling a couple of pills for blood pressure or whatever. Now it's oral chemotherapy, anti-nausea meds, maybe pain relievers, steroids, and they all have these confusing schedules, specific instructions. It's so easy to feel like you're just drowning in pill bottles, right?
Yeah.
And kind of bewildered by it all.
Yeah, that feeling you describe. Being completely overwhelmed, it's more than just inconvenient. It really hits right at the core of effective treatment. You see, just a simple mistake, maybe forgetting a dose or taking a pill at the wrong time, even taking it with the wrong food, like grapefruit juice, which we can talk about later, that can have really serious consequences. We've seen it lead to, unnecessary side effects, sometimes trips to the emergency room. And critically, for oncology patients, it can actually reduce how well those vital treatments work. So managing meds isn't just a chore, it's actively taking part in your own care, making it work.
The stakes really are incredibly high, like you said. So our mission today really is to arm you with some practical, empowering tools and knowledge. We're going to explore how to set up what we're calling a medication station. And think of it not just as tidying up bottles, it's more like establishing a real command center. A central hub for your health. It's a system designed to boost safety, make sure you're consistent, and honestly, just bring some peace of mind. And we'll be drawing a lot from the insights of a geriatric oncologist, understanding why these strategies are especially crucial for older adults facing these complex diagnoses. Okay, so let's unpack this a bit more. This situation, it's so common, isn't it? Particularly for older adults. They might already be juggling prescriptions, for chronic things, blood pressure, maybe arthritis, diabetes. Then boom, a cancer diagnosis adds this whole new layer. You've got specialized oral chemo that has to be taken just so. Anti-nausea meds that are time sensitive, maybe pain relievers, steroids. Suddenly you're staring at like a dozen bottles. All with tiny print, different doses, instructions like take with food, empty stomach, avoid sun. It's curtain. Yeah. Information overload.
Exactly. And what's often underestimated is how that very complexity directly ties into treatment success, especially in oncology. From a geriatric oncology perspective, we know older adults often process drugs differently. Maybe their metabolism is altered or they have other health issues, comorbidities. This can make them much more sensitive to drug interactions or, the impact of a missed dose. And studies, they consistently show that not sticking to complex medication plans, especially for chronic diseases and cancer, can cut treatment effectiveness by, sometimes as much as 30%. For cancer treatment, where timing and dosage are just paramount at the 30% reduction, that translates to a real measurable impact on outcomes. So taking control of your meds proactively, it isn't just helpful, it's actually a critical part of your prognosis.
Wow. 30%, that's a really sobering number.
Yeah.
It really highlights why taking control is just so vital. It's about, like you said, turning that source of anxiety into a system. It's a system of control. And that is exactly what a dedicated, well-organized medication station can help you achieve. Okay, so let's start right at the beginning. If you're building this command center, the very first big decision is location. Where is it going to live? And here's the absolute number one rule, apparently, coming from our geriatric oncologist sources, not in the bathroom.
Right. And you're touching on something that's surprisingly common, but potentially dangerous. Most people just assume, the bathroom cabinet's the spot. It's convenient, right? But the reason it's really unsuitable, especially for older patients whose bodies might handle drugs differently, is the heat and humidity. From showers, baths. It can actually degrade the medications, break them down chemically. And this isn't just a minor thing. It can make the drug less effective, or sometimes even harmful, maybe even toxic. It's sort of a hidden form of medication mismanagement that can really undermine vital treatments without you even realizing it's happening.
That's fascinating and really crucial. Okay, so if the bathroom is definitely out, what are we looking for? What makes an ideal spot for this station?
Well, basically, you want to try and mimic pharmacy storage conditions as best you can in your home. So that means finding a spot that's consistently cool and dry, definitely away from heat sources like, the oven or direct sunlight, and away from moisture like the sink. It also absolutely needs to be well lit. That's critical when you're trying to read tiny labels, maybe your vision isn't perfect, and easily accessible for you or a caregiver. But importantly, not somewhere it's likely to get knocked over, so not a high traffic area. And a big one for families, security. If you have grandkids visiting or even curious pets, it has to be out of reach, secure.
Okay, cool, dry, well-lit, accessible but not too accessible, and secure. Sounds like a bit of a checklist, but I imagine there are practical places in most homes.
Oh, absolutely. Think about maybe a dedicated shelf in a kitchen cabinet. Just make sure it's away from the stove's heat and the sink's humidity. That's key. Or maybe a drawer in a bedroom dresser. That often works really well. Or even just a small, sturdy table in a quiet corner of the living room somewhere it won't be disturbed. And an important point from the sources. If you're prescribed controlled substances, like strong pain medications, seriously consider getting a lockbox to keep them in, even within that chosen secure spot. It's just an extra important layer of safety.
Right, the lockbox makes sense for certain meds. Okay, so we found the perfect secure spot. Now, step 2 is equipping it. What tools do we actually need to assemble to make this command center work properly?
Yeah, this is about getting everything you need in one place, so you're not hunting around, getting confused later. And the absolute heart of your station really is the right pill organizer. We're not just talking any old plastic box here. You need to look for one with compartments that are actually big enough to hold all the pills for one specific time slot. Some cancer regimens involve, several pills at once. And easy to open lids, that's really critical, especially if you're dealing with arthritis or maybe just reduced dexterity in your hands. Now, there are lots of options, simple daily AM/PM trays, even monthly systems, but our sources, and frankly my own experience too, usually recommend a weekly organizer. One with at least 2 slots per day, morning and evening, seems to be the most practical for most complex situations. It gives you good organization without being, totally overwhelming to fill.
That makes a lot of sense. A weekly one, AM/PM slots.
Yeah.
Okay. And then for a real command center, you need the map, right?
Precisely. That's a great way to put it. The single most important document you'll have at your medication station is your master medication list. This isn't just like a helpful little note. It's your roadmap. It's your safety net. It's your communication tool with doctors, pharmacists, everyone. And it has to be clear, ideally typed, or at least written in really clear, large print. Easy to read at a glance.
Okay, that master list sounds absolutely crucial. What specific information must be on it?
Every single entry needs the full picture. You absolutely need the medication name, and list both the brand and the generic name, if you know it. That avoids confusion. The dosage. Be specific, like 500 milligrams, not just one pill, its purpose. And write it in plain language for pain, for blood pressure, oral chemotherapy for breast cancer. This helps you remember why you're taking each one, the specific schedule. And I really want to stress specific here, not just twice a day. Write down one pill twice a day at 9 a.m. and 9 p.m. No ambiguity. Any special instructions, these are vital. Things like take with a full meal, take on an empty stomach, do not crush. These instructions are there for crucial reasons, affecting how the drug is absorbed or preventing side effects, especially important for older adults, maybe with sensitive stomachs. And finally, the prescribing doctor's name, so you know exactly who to call if you have a question about that specific medication. Keep this list updated, and maybe make a copy for your wallet or give one to a trusted family member.
That's incredibly thorough. Okay, so beyond the organizer in this vital master list, what other bits and pieces, what accessories kind of round out the ideal medication station?
Yeah, think about things that just help you stay organized and safe day to day. A small notebook and a pen are really essential. Use it for logging any as-needed medications, like if you take an extra pain pill, note the time and why. Also great for jotting down side effects you notice or questions that pop into your head for your next doctor's visit. A pill splitter or crusher can be useful, but, and this is a huge safety warning, never split or crush a pill unless your pharmacist or oncologist has explicitly told you it's okay. Many pills, especially coated ones or time-release formulas, can become dangerous or just stop working properly if you alter them, so always ask first. A simple magnifying glass. Surprisingly handy for that tiny print on bottles. A calendar, or maybe a small whiteboard, is great for keeping track of when you need to order refills. Easy to forget otherwise. And, critically important, have phone numbers clearly posted right there. Your pharmacy, your oncologist's office, your primary care doctor. Quick access in case of questions. Oh, and one more thing, if you use any injectable medications, you absolutely need a dedicated sharps container. That's the puncture-proof container for safely getting rid of used needles and syringes. Must have.
Okay, great checklist of accessories there. So we've got the perfect spot picked out, all the tools are assembled. The next really crucial step is the actual process, filling the pill organizer. You frame this as more than just a chore, right? You call it a weekly safety check-in.
Exactly right. This isn't just about mindlessly emptying bottles into slots. It's a dedicated time, a quiet ritual designed purely to minimize the chance of making a mistake. We strongly, strongly recommend setting aside maybe 15-20 minutes each week where you create a no-interruption zone. Turn off the TV, silence your phone, maybe ask family members not to disturb you just for that short period. It's a small investment of time, but the payoff in accuracy and, frankly, peace of mind is huge. And, before you even touch a pill bottle, simple step, but important, wash your hands thoroughly.
Right, create that focus zone. And then within that zone, there's a very specific technique you recommend for actually filling the organizer, something called the one-at-a-time method.
Yes. This method is super methodical, very deliberate, and it's designed to pretty much eliminate common errors. Here's how it works. You lay out your weekly pill organizer and all of your original prescription bottles. Have your master medication list right there in front of you. Now, here's the absolute key. Pick up only one medication bottle, just one. Read the label on that bottle carefully. Check the name, the dosage, the instructions, compare it against your master list to be sure. Then, and only then, carefully place that single medication into all the correct compartments in your organizer for the entire week. Once you've done that for the whole week for that one drug, put that bottle completely away, like off the table, before you even think about picking up the next bottle. This step-by-step focused approach makes it incredibly difficult to accidentally mix pills up or double a dose or forget one entirely because your full attention is just on one medication at that moment. And, for an extra layer of safety, especially if you're feeling tired or maybe experiencing a bit of chemo brain fog. If possible, ask a family member or a caregiver just to double-check the filled organizer against your list. It's a simple check that can catch things.
That method, it makes so much sense when you explain it. It's almost beautifully simple, but you can see how effective it would be. Okay, so a well-organized station, this meticulous filling ritual, these are fantastic defenses. But you also stressed earlier that ongoing vigilance is still key, right? It's not just set it up and forget it.
Precisely. You've got it set up. But there are crucial ongoing practices for long-term safety, especially with these complex cancer treatments. First big one, and this is vital for preventing accidental overdoses. Never mix as-needed pills into your weekly organizer. So medications you only take sometimes, maybe an anti-nausea pill when symptoms flare up, or a breakthrough pain reliever, those need to stay in their original bottles, clearly labeled. When you do take an as-needed dose, grab that notebook we talked about and immediately write down the time, the dose, and why you took it. This is so important because it stops you from accidentally taking too much, and it gives your doctor a really clear, accurate picture of how often your symptoms are breaking through your regular meds. Okay, second point, a question we get constantly. What if I miss a dose? What do I do? The answer is almost always, universally, do not double up. Don't take 2 doses next time. Doubling up can be way more dangerous than missing 1 dose, especially with powerful medications like chemo or strong pain meds. What you should do depends entirely on the specific drug, its half-life, your treatment plan. So your absolute first step always is to call. Call your pharmacist or call your doctor's office and get precise instructions from them. Don't guess. Don't just try to catch up on your own. Third thing, and this is honestly a potential lifesaver for overall medication safety, we recommend doing what's called a brown bag review, at least once a year, maybe more often if your meds change frequently. This means you literally gather up everything you take, every single thing. All your prescription bottles, yes, but also over-the-counter stuff like Tylenol or allergy meds, all your vitamins, any herbal supplements, everything. Put it all in a bag, hence the name, and take that bag with you to your next appointment with your pharmacist or your doctor. This kind of comprehensive review is one of the absolute best ways to catch dangerous drug interactions, maybe spot duplicate therapies you didn't realize you were on, or find old, outdated prescriptions that should be tossed. It's an invaluable safety check. It really uncovers hidden risks. And finally, a really important warning that often gets missed. Beware of supplements. Please hear this. The word natural does not mean safe, not automatically. Especially not for older adults, and especially not when you're undergoing cancer treatment. Many herbal products, even ones that sound harmless, like St. John's wort, they can interact dangerously with chemotherapy drugs, mess with how your body processes them, change their effectiveness. Even common things like grapefruit juice can severely impact how certain medications are absorbed. It's a well-known interaction. And some antioxidants, which might be good in other situations, can actually interfere with how certain chemotherapies are supposed to work. So the advice here is crystal clear, unwavering. You should never start taking a new vitamin or supplement, doesn't matter how harmless you think it is, without getting explicit approval from your oncologist first. Your body's chemistry during treatment is really sensitive, and these interactions can seriously impact your health and how well your treatment works.
Wow. This whole deep dive has really hammered home just how impactful taking charge of your medications can be. Setting up this medication station, following these steps, it feels like one of those significant proactive things you can actually do for your own care.
Absolutely. And if we kind of zoom out, connect this to the bigger picture of your whole health journey, this proactive approach, it really does transform something that can be a huge source of anxiety, maybe even fear, into a robust system of control, giving confidence. Confidence that you're doing everything possible to make your treatment as safe as it can be, as effective as it can be, and free from those preventable mistakes. You know, in the complex world of modern medicine, particularly cancer care, this medication station becomes your personal pillar of strength, your command center.
So as you think about all this, maybe consider not just the physical safety benefits of setting up a system like this command center. Think also about the profound impact it can have on just reducing stress, enhancing that feeling of agency, of being in control during your health journey. It's about taking back some power where you might feel pretty powerless sometimes. And maybe, just maybe, think about other areas in your life. Are there other places where a similar approach, bringing deliberate order, clear information, creating a kind of command center, could bring you more peace of mind, more effectiveness? Something to think about. Thank you for joining us on The Deep Dive.